My name is Martin Kiwi. I work in the Gender and Human Rights branch at UNFPA in New York, and I'm the moderator for today's session. And first, I'd like to hand over to Nafisatou Diop, the Chief of the Gender and Human Rights branch, for some welcome remarks. The floor is yours, Nafi.
Thank you so much, Martin, and good morning, good afternoon, distinguished panelists, and all the participants joining from any place in the world. We are very happy to organize this session on the engagement of men and boys. I just want to say that each year, millions of girls are subjected to practices that harm them physically and emotionally with the full knowledge and consent of their families, friends, and communities. So this sentence is according to the State of the World Population 2020, Against My Will, that was released last year by the UNFPA, the United Nations Sexual and Reproductive Health Agency. We know that there is at least 90 harmful practices, ranging from breast ironing to virginity testing, that are considered human rights violations. However, for UNFPA, we are focusing on three most prevalent ones: female genital mutilation, child marriage, and extreme bias against daughter in favor of son. What we want to, if we look at some data, we know that approximately 4.1 million girls will be subjected to female genital mutilation, each year. We know that approximately 33,000 girls under the age of 18 will be forced into marriage, usually to much older men. And we know also that extreme preference for sons over daughters in some countries has full gender-biased sex selection or extreme neglect that leads to their deaths as children, resulting in 140 million missing females. So some harmful practices are waning in countries where they have been most prevalent. But because of population growth in those countries, the number of girls subjected to them will actually rise in the coming decades if urgent action is not taken. So today, our discussion today is about the engagement of men and boys for achieving gender equality. And what are the good practices that we have seen over the years in that particular area? We all know that without it, we won't be able to achieve the change that we are expecting, particularly, for harmful practices. We know that we must tackle the problem by tackling the root cause, especially gender-biased norms. So we must look at the community. We must empower those communities with, in their own effort and capacity to understand the toll these harmful practices are taking on girls and women, and the benefits that accrue to the whole of society by stopping them. Men and boys engagement is at the heart of it, and at the heart of what we call, of course, and we know is a social norm. So in order to address and to change this and tackle those harmful social and gender norms, we know that it's very important to look at their role within the community, but also, recognize the influential capacity. Most of political, religious, traditional leaders in communities all around the world are mainly men. And if the change needs to happen, it has to happen with those at the forefront of the change, triggering the change. And the small video that we have seen has shown how in the School of Husbands in Niger, which has been scaled up in a lot of other countries in West Africa, we're able to increase the use of sexual and reproductive health services, increase the use of maternal health services, prenatal care, postnatal care, service delivery for birth, for giving birth, but also the use of contraception, just because the husband and the men in the community have been engaged strongly into this, into this issue. If the women were not going to the health facility to get those services, it was mainly because the husband was against. And we have statistics that are showing that unmet need for family planning, when you look at the reasons why the women, are not accessing family planning, is mainly because of their husband or their partners. So we need to really break that, issue and look at how we can use them as, partner, but how we can move forward, the knowledge to the action. So I think that I will just want to conclude in saying that progress has been made in ending some harmful practices worldwide, and we have the statistics that are showing that. But the COVID-19 pandemic that we are, facing now has threatened to reverse gains. We know that UNFPA has released last year some projection that were showing that if services and programs remain shuttered for 6 months, an additional 13 million girls may be forced into marriage, and 2 million more girls may be subjected to female genital mutilation between now and 2030. So the pandemic makes our job harder and more urgent. Also, so many more girls are now at risk. So we need really to improve what we are doing. We need to innovate. We need to strengthen our partnership with civil society organizations, with human rights defenders, with young feminist leadership, with men and boys, with traditional leaders, religious leaders, and all these influential people who can really step in and make the change happen. I would like to welcome you again to this session, and thank you, and waiting forward for a very interesting discussion. Thank you so much.
Thank you very much, Nafissatou. And I'm seeing that the number of participants is increasing. So I would also like to take this opportunity to welcome everyone that has just joined. And that was Nafissatou Diop from UNFPA in New York, the chief of the Gender and Human Rights branch, that welcomed us to the meeting and also put emphasized the importance of harmful practices. And also, sorry, I was muted.
Mm-hmm.
Yeah, sorry. So yes, I was saying that NAFIA highlighted the State of the World Population 2020 that focused on harmful practices, and I've also added the link to the swap in the chat box. So thank you very much, Nafissatou, and welcome everyone that has joined. I'm just going to take a few minutes to share the set the scene for the session. These are the objectives of today's session. It's to, excuse me, I was managing here. So highlight the importance of engaging men and boys to promote gender justice and harmful practices at all levels of the socio-ecological system, at formal, informal levels. And it's to showcase how UNFPA and partners have undertaken this work over the years, and to convene a dialogue with various stakeholders on how to continue building and improving action in this field of work. And this session is designed based on the socio-ecological model that illustrates opportunities for gender transformative programming, engaging men and boys. And the socio-ecological model is based on the notion that gender transformative programming can take place at various levels, including individual, interpersonal, community, systems, and a policy level. And this also includes working in multiple sectors and working at formal and informal levels. And male engagement is important for work throughout the different levels. So today, a glance at today's program, we're now in the opening, and then we have a number of speakers that will address male engagement across levels of the socio-ecological model. And then we're very happy to also have with us a number of people from the field representing government and civil society organizations. They're going to share their experience and lessons learned. And then we have a few minutes for Q&A, and then around 9:30, a bit after that, the event will be closing. And I'd like to encourage you to please use the chat to share reflections and questions during the session, so that we have an active discussion also going throughout the session and not only during the Q&A. And with this, I'd like to hand over to the first speaker, who is Leila Sharafi, who will address gender synchronized programming and the Women's Agency, Women's and Girls Agency. So please, Leila, go ahead.
Thank you so much, Martin, and thank you, Nafi and Jose Roberto. Can you hear me?
Yes, thank you.
Great, and I see you are getting the presentation up, so I will start speaking. So my name's Leila Sharafi. I am the gender advisor for UNFPA in the Gender and Human Rights branch at the Technical Division based in New York. This is just an overview kind of to set the scene. As Martin said, we'll have more specific presentations from exciting speakers talking about engaging men and boys, particularly around ending harmful practices. But I did want to give an overarching kind of presentation on the importance of working with men and boys, engaging men and boys as partners for promoting women and girls' rights for gender justice. Next slide, please. What do we know? So this is the third Men Engaged Symposium, and it's an honor to have been participating in all of them to date. So that just tells you that this is not a new subject. We have been talking about the role of men and boys in promoting gender equality, women and girls' rights, and gender justice. So what we've learned over the years are just a few non-exhaustive examples here, but what we certainly know, and is pretty widely known at this point, is that gender justice cannot be achieved alone. It really is an approach that takes a whole of society to be involved, because we all live in interconnected ways. We also know, as Martin said, that we should really apply an ecological model when thinking about engaging men and boys. That means from the top national level to the regional level to community level, down to the interpersonal household level and individual level. We also need to think relationally. And what does that mean? It means that, as I said, we all live interconnected lives. So any women and girls empowerment initiative really has to take into consideration what the dynamics, the considerations, and the situation might be for men and boys within that community, and vice versa. And I'll get more into that later in the slides. Well, change is happening. As Nafi said, there have been advances, both in terms of gender inequality. The Beijing 25 process took place last year, and the report showed us that we are making advances in women and girls' health, women and girls' education, and that is really positive. But what we also know is that deeply entrenched social norms continue to force women and girls to face discrimination and violence. We also know that young men, according to the Images surveys, really do want to be part of change. We do see that they're more receptive to norms that, let's say, are less rigid than their previous generations. Many know that improving women and girls' status and rights yields benefits for everyone. I think that's a fairly widely accepted concept at this point. Of course, it depends where you are and the context, but certainly in the development community, those working in humanitarian, we understand now, right? But at the individual level, what seems to be showing from the evidence is the how, and the intention from men to actual action is not always clear, right? So I think the focus now, and when some of the things that I see more conversations going on at this Men Engaged Symposium is really the operations, behind how to get to that action. We also know that gender transformative programming, at least in the area of SRHR and for other areas, is critical. We know that in order to move forward the needle, the program should really be focused on challenging the underlying gender power dynamics, etc. But we also know, and from evidence that was presented last week during the WHO and others hosted a session at Men Engaged Symposium, that these gender transformative programs are few, really few. And that is something we also learned within UNFPA, and something that we're really striving as an institution to try to improve as we go forward. We also know from evidence that effective programs are really multi-pronged programs that have different arms within it, right? So programs that have education focus, so small workshops, small education programs that gather community members and men and women, wider community engagement, a gender synchronized approach, which is what I said at the beginning about thinking relationally. And this is really important, a long-term view, right? At least 3 months or more engagement around gender norms, etc. Next slide, please. So this set of icons and infographics comes from our friends at Women Deliver Promundo and the Dove Men Care initiative. And I just thought it was important to highlight when men and boys do act or behave or model certain behaviors, some great things happen, right? So if you look at the icon on the left-hand side, we know that when men and boys are educated on the benefits of contraception, for example, they are more likely to support women's use of contraceptives and have autonomy over their bodies. UNFPA did an analysis of SDG target 5.6, and what we found globally is that only 55% of women say they make their own decisions about SRHR. That's being able to say no to sex, making decisions around contraceptive use, and decisions around their own reproductive health. So we have a long, long way to go. We also know that when girls see their fathers engaging in domestic care and work, they are more likely to work outside the home and pursue occupations that really go beyond the ones that have gender stereotypes, right? So getting more girls into the field of STEM, for example, and many other examples. And finally, when men and boys learn more about harmful practices such as female genital mutilation, and we'll have speakers talking more specifically about that, they are more likely to advocate to systematically abandon the practice. Next slide, please. Next slide. Great. So there's so much that I could say about each of the bullets on the what do we know slide, but I'm going to focus a little bit on gender synchronized approaches. And I think it's important to say that it sounds like a complicated term, but essentially it is looking at the intersection between gender transformative efforts that reach both men and boys and women and girls of all gender orientations and gender identities from the outset of planning a program, intervention, and so forth. So the idea is gender synchronized approaches engage people really in challenging harmful and restrictive constructions of masculinity and femininity that drive the gender-related vulnerabilities and inequalities and hinder health and well-being. So if you think about some of these programs, and I'll talk about a couple of them, these programs view all actors in society in relation to each other, right? And they try to seek to identify what are some of the shared values among women and men with the range of roles that they play in society, whether it's the mother-in-law, the father, the wife, the brother, caregiver, and so on. And then try to promote those values from a human rights-based approach, but really try to build that understanding of mutual support for health, nonviolence, equality, and gender justice. So these approaches can happen simultaneously or sequentially, but the idea is that there is a programmatic umbrella and under which you either work with men and boys and women and girls, and you don't have to do as an organization all of it yourself, but have a strong partnership strategy and work in coordination with other organizations. But the idea, the most basic underlying principle is that we all live in a relational world, and when seeking to work with particular population groups in a society, we should really think about how these interventions, let's say with men and boys, are going to impact the women and girls and vice versa. Next slide, please. So Martin talked about working at all levels to change norms, and I've just put up an illustration of a few different examples. Again, there are many that are out there, and I do believe we'll hear about some of them from the other speakers, and I think my colleague may even talk about the Georgia example, but this is an example of working at all levels to change norms, but from a gender synchronized approach. So from the context of Zambia, there's a program, right, that UNFPA also supports, working with marginalized adolescent girls, including to prevent child marriage. But the program intentionally set up safe spaces for both boys and girls from the outset, right? And they're focused on building life skills for their health, social, and economic assets. They really wanted to ensure that there was a space for boys and girls to think about some of these different gender norms that they have been living with and raised with and behaving upon. So it's an interesting example of how at the individual level trying to affect norm change, but really thinking about it from a gender synchronized approach. We also have the example of SASA by Raising Voices in Uganda. And this is really about changing norms around gender inequality, but also trying to affect change around HIV, violence against women and girls. And this is an example of community level engagement, but also particularly at the interpersonal level. So trying to have more communication between partners, couples, and the evaluations have shown that, in fact, this is happening, and the program in that sense is using a synchronized approach. And we see great impact from the SASA program in terms of changing the indicators around violence against women and HIV and SRHR. And in Georgia, UNFPA, ManEngage, and Promundo and other partners are really working at all levels, but in particular, I wanted to point out the fact that at the community level, trying to challenge norms, particularly around reproductive labor or care work and gender roles and responsibilities through a program there. And I won't go into details because I believe this program will be talked about a bit more in detail. You know, there are other examples where UNFPA has also supported work, particularly in this area of getting men and boys to practice non-stereotypical roles and responsibilities, which can really affect change around other types of behaviors in terms of violence, in terms of you know, non-discrimination for men and boys, for women and girls, sorry. And I think that's my last slide. Next slide. Yep, thank you so much.
Thank you very much, Leila. So please, participants, if you have any reflections or questions to Leila, please share them in the chat. I don't think we have any questions or comments thus far. So then we proceed in the program, and our next speaker is Nafissatou Diop, the Chief of the Gender and Human Rights Branch at UNFPA HQ. And she will talk about the importance of social norms change when it comes to addressing harmful practices. Please, Nafissatou.
Yes, thank you so much. Thank you, Leila. That was really a fantastic, some fantastic points that you raised. I just want to continue a little bit this reflection because you have touched some of this issue, and I think it will be important to maybe break down, you know, how this can happen. So beyond, behind the successful, you know, model and example that we are seeing in different countries, and you gave 3 country example, what exactly that means to reach that level. So I just want to flag that we, as UNFPA, has released a document named How Changing Social Norms is Crucial to Achieving Gender Equality. And that document is designed to help organizations and communities achieve the change that they want at scale. And I would like to insist on the at scale, and therefore, of course, achieve gender equality. So beyond providing information and creating spaces for discussion, which is the basis of all programming that engage women, girls, men, boys, traditional leaders, etc. So this is things that are usually happening in our field when you are, you know, addressing a particular issue. Of course, everything starts with knowledge, with information, with a discussion, and then you create space and you know, and venue where this discussion will take place. So those are what, you know, civil society organizations, activists, you know, everybody is doing. And we know that we have a strong partnership with the media also, who are bringing that information, and the media and the TV or the radio is a space of discussion. So those are very good things that are happening. However, when you are facing a social norm, as you know, social norm, a harmful social norm, as we have listed, you know, female genital mutilation, child marriage, son preferences, and other, you know, that have to do with the low value of girls and women within the society. There is a need to collectively deliberate, and I will say again, collectively deliberate and explicitly agree together to improve the health, the well-being of girls, of women, of the community. So we need to find a way to create that movement that is going to address those discriminatory norms. And we need to really ensure that this is going to be contextualized, because context is crucial and there is no one size fits all approach. But what we know is that the individual behavior change, which can be triggered by knowledge, information that you're bringing, you know, and evidence that something is harmful, you know, has some limitation. And if you want to move to scale, you really need to, you know, to complement that, because this is the base. As I said, this is where it's starting. You're starting with knowledge and information, but then you have to complement it with some other elements. And so, so I would like to just take a few minutes to talk about that. And, you know, we know that, you know, the behavior of one person can make a difference. This is true that we have, you know, as we said, you know, early adopters, you know, and for decades, we have this model and the framework from Rogers, who was showing that in all changes, you have those who are early adopters. And then if those early adopters are able to be strong enough, those are somewhere the innovators and all. But if they're strong enough, if they are influenced, then you can have other people who are going to join them. And the whole work is to ensure that the group of people will increase and that you are going to have a snowball process. That the group of who are thinking, you know, differently than the norm that is established in those communities will be, you know, stronger and more numerous. And it is, but to do that, you need to ensure that they are the one themselves who will see the benefits of recruiting other. So of bringing other into their way of thinking. And the change needs to come from within. So as we used to say, the message is important, but the messenger is more important. So community influencers, you know, not only political leaders or prominent figures, we know that those people are very important. And I can, you know, we have the recent example of, you know, if I can say that, of the US, for example, where you can have a prominent political figure who can lead a whole group in a negative way of thinking, if I can say that, of lack of tolerance, you know, and everything that we are defending as human rights defenders. But the contrary do exist, that you have political and community leaders and prominent figures that can lead the change. That's what we have seen. And the best example is Martin Luther King, for example, that's with I Dream, the I Dream, and that speech has been incredible and has changed the whole world, if I can say that. So that can exist. However, you have also, you know, people who seems to be more prominent figures and who can lead the change. And so young people, if they are in power, you know, there are a lot of them who are leadership. Women, if they have agency, they are in power, they can lead the change. So this can complement, and one of our work, as Leila said when she mentioned gender synchronization, is to ensure that we will have those two, you know, moving together in the same direction. Because we need to recognize again that men and boys, you know, in particular men, are the political leaders, are the traditional leaders, the religious leaders, most of them prominent figures. Maybe the only exception is a little bit in the entertainment world, where we do have a lot of women leaders who are influencing also. So I will just say one or two additional points. That it is generally a complex and iterative process. multisectoral and holistic and culturally sensitive approach. So the context is important. The culture is important. You need to adapt to it. You need to ensure that the community is driving and is the agent driving the change. You need to ensure that the coordination, of the people will take place. So it may start with one person, but that person need to start recruiting the other and have the group growing. And we need to find a way to coordinate that movement in order to strengthen even that only person has its doubts. It's not easy to be a positive deviant when you have a norm in place. But then the more the group grow and the more, they will find a way to be supportive to each other, to influence each other. And this is how the change is starting. Another point that is important is really to ensure that the spreading and the snowball process will take place by adding some additional components. And one of those components is what we call the organized diffusion of the information. Organized because you have to start somewhere and you have to reach out to others. And you start by those who are closer to you, and then you expand. So those are things that we have understood. Another, maybe my last point is that we have understood that there is two possibilities for processing, for change, two possibilities to make the change. One is, the abandonment of maladaptive norm at first, and thereafter you create a new norm. And the second one is the creation of a new positive norm at first, and then therefore you destabilize the original norm. So it's two ways of doing things. And what could be very interesting now is to conduct more research to look at which one is the best. But as I said, context is important. So probably the two ways are fine, but will depend on the particular issue and of that context. Are you going to create first the new norm and destabilize the other one? Or are you first, pushing for the abandonment of a maladaptive norm, and then you create the new positive norm? So thank you so much. I will just stop there. Thank you.
Thank you so much, Nafsa, too, and for highlighting this very important topic of social norms change when ending harmful practices. And I've also included the link to the UNFPA publication from last year in the chat. So if people would like to read and learn more about what Nafi just discussed, please refer to that link. I also see that there's a comment from the National Union of Algerian Women highlighting the role of religious places in actors when changing and correcting norms. And I think that is something that that also Nafsa too mentioned, that religious and traditional leaders can be an important stakeholder when working to address norms. I also see that Jose Roberto has shared a link to a technical note on gender transformative approaches when addressing child marriage. So that's a brief summary of what's happening in the chat. And with this, I'd like to move on, noting that we're a little bit behind schedule. And the next speaker is Nurgul Kinderbayeva. She's the gender program specialist at the UNFPA regional office for Eastern Europe and Central Asia. And she'll talk to the redistribution of power and resources and highlight the role of family policies to change gender stereotypes in engaging men in care. So please, Nurgul, the floor is yours, and I'll share your presentation from this end.
Thank you very much, Martin, and good morning and good afternoon, dear colleagues. First of all, I would like, on behalf of ICARO, to thank the organizers of this event for inviting ICA region to participate and share our work on Men Engage. So thank you very much. Today, because of the time limit, that I will give you a brief snapshot on Men Engage program in ICA region. And I would like to start my presentation with some data that we got from the International Men and Gender Equality Survey images. So more than 60% of women and more than 70% of men in Kosovo either agree or partially agree that changing diapers, giving children a bath and feeding the children are the woman's responsibility. 27% of women in Georgia stated that they share domestic work with their husbands. And in Moldova, Armenia, and some other countries, both surveyed men and women believe that women must tolerate violence in order to preserve the family. So, what is Eastern Europe and Central Asia? The region which is culturally and socially very diverse region, and all the countries in the region has strong gender divide and traditional gender norms. And while speaking about the challenges, also those challenges related to gender equality interplay with some other complex issues, different factors, like, for example, race and conservatism, patriarchal attitudes, and backlash against women's rights. And all these things are going on with the consequences of the economic crisis in the region, and governments pushed to take austerity measures in order to address this. And also those measures are just at the expense of women's rights. For example, just one example, cutting social services, freezing social assistance programs, and also lack adequate investment to the social programs. All these things just factors just placing the burden on unpaid care work on women. So taking all this into consideration, male involvement came out to be one of the entry points for UNFPA to promote gender equality, but also bring men as allies and agents of change. And in our region, UNFPA works in several streams, and one of the streams is gender responsive family policies. And through these policies, we offering kind of a combination of fertility and career aspirations, as well as addressing unpaid care work, which is often considered in our region as a secondary issue. The majority of the countries in our region, 3 or more years of maternity leave, but even just very little or even no paternity leave. The second stream is, of course, addressing harmful social norms that we are speaking a lot about that. And this is another very, very critical area that we are focusing now. And through supporting advocacy, changing attitudes, behaviors of individuals. For example, through responsible fatherhood programming, we are supporting participation men in antenatal visits as a gateway for their active involvement in their family life. So we're also looking at the community level and work with gatekeepers. We are working with media and sports clubs. We are also working with traditional bodies like faith-based organizations and other parts. And another stream also mobilizing societies through social media platforms such as UNFPA, ICA Men Engage platform, Eastern Europe and Central Asia Men Engage platform. And we promote regional debates, webinars related to masculinity, fatherhood, and engaging men and boys in preventing gender-based violence. Next slide, please. So how we work, what we are doing. We upscale, we contextualize, and we institutionalize gender transformative approaches so that they can have a wider impact on people and individuals. And by working together, what we are doing, we are producing, developing advocacy and knowledge products. We conduct research, for example, images. And images has already been conducted in 8 countries across the region. So we are also doing curriculum-based interventions, for example, boy clubs in vocational schools, or GBV prevention and prevention of harmful practices at secondary schools, engaging boys. Also, we are doing SRHR promotion in the Roma community and many other curriculum, just engaging men and boys in SRHR issues. So partnership is critical for us. And we are partnering at different levels with governments, with civil society, both at regional and national levels, academia, research institutions, and also working with individual experts in order to bring them and to exchange them all together, all those global and regional experiences, expertise, and good practices and lessons learned. So all our common goal is just to make a difference on the ground, both to policy making and behavior change. So many care campaigns are also implemented in almost all countries in our region. And through this men care campaign, we establishing different type of partnerships with non-traditional partners, with private sector, media and advertising companies, and engaging also celebrities and sport actors. The next slide, please. Yes, this is our Men Engage platform, and we use it as a knowledge management tool. And this serves as a repository of different research, knowledge, and expertise from within and beyond of the region. And the purpose is just to collect global and regional level research, different type of materials, knowledge products, so that they can be easily accessible to our partners, to our members, and individual experts, those who are working or interested to work on gender transformative programming. So this platform is also used as a promotion of country level initiatives throughout the region as well. The next slide, please. So here is the lessons learned and the key takeaways. And also answering the questions of this panel. What needs to be done to ensure women's access, redistribution to resources, and what men and boys can do to take part in the redistribution of power? So the first thing that implementation of gender responsive family policies, both national policies and legislation, as well as policies implemented by the private sector, are powerful strategies to shift discriminatory gender norms and redistribute unpaid care work. So in this case, women will be more likely to have a number of children, to decide how many children they can have, and also actively participate in economy and public life. At the same time, with these policies, men can allow better be engaged in sexual, reproductive, and family planning issues, and become more engaged fathers. The second thing, that social norms change is necessary enabler. And it has very powerful effect on how gender discrimination patterns are just operating in family and in society and in the community. And as Nafi just mentioned today, that I also would like to support her that once the change happens on an individual level, which includes power relations between women and men, change in values, beliefs, and attitudes, and practices, it can just be projected from individual to the community, and from the community to society, and from the society to the whole region. And the last but not least, engaging men in childcare in particular is a very promising entry point to challenge inequitable division in the paid and care economy, and improve sexual and reproductive health and rights, and prevent violence against women and girls. And the last one is just a bigger picture. Yeah, dismantling narrow and harmful gender roles contributes to greater equality, stability, and prosperity for all. Thank you so much.
Thank you very much, Nurgul. And I know you have a rich experience in Eastern Europe and Central Asia, working with men and boys to advance SRHR and gender equality. And thank you so much for highlighting the importance of the redistribution of power and resources to address gender equality, which is I mean, one of the root causes of so many issues that we're battling with today. So thank you very much.
Thank you.
Thank you. I'm just having a look at the chat if there's any. So yes, no. So I suggest we move on in the program, and our next speaker is Jose Roberto Luna. He's a technical specialist for adolescents and youth and child marriage at UNFPA in New York. And he'll be talking about engaging men and boys in transforming formal rules, laws, policies, and systems. So please go ahead, Jose Roberto.
Thank you, Martin, and thank you to all, of the previous speakers. We can go now to the policy level, and just reflecting that we were invited to join this conversation around engaging men and boys in gender justice and to end harmful practices. And that means that, if we are looking for gender justice, we have to work with men and boys looking for, a systemic redistribution of power, opportunities, and resources. And in that sense, just looking back in terms of where we are at the policy level by engaging men and boys, is, how we can complement the work on social norm change that usually happens at the individual, interpersonal, and community level to the policy level where the formal norms are, in place. So I was, analyzing where we are, and, we have, various gaps. We have an extensive work in social norm change at the community and interpersonal level, but less systematic work at the policy level. We have, different examples across regions, but not necessarily systematic approaches to that. Few programs are really targeting men and boys at the policy and systems level from a gender transformative approach. And, even if when we are trying to express, different examples or looking at examples, we usually are sharing the experience of Brazil working, at the health system with a national policy for men in SRHR and fatherhood, but less examples are coming up, during the years, even from the first symposium when we were, in Brazil and then in Delhi. Few programs are also institutionalized at the policy level. And some of them are just working, in very focused areas. We also can look at different opportunities if we are, looking for really working with men and boys, and we have to also capture the different dimensions and identities that, men can also bring to the table as decision makers, are, fathers, as, community members, gatekeepers, and also as policy makers, if we really want to sustain change at the policy level. And also, the upcoming example from India will address a little bit on that. So, but we have the opportunity to working with boys at early ages through comprehensive sexuality education, for instance, is if we are able to advocate for the inclusion of, strong gender elements and gender transformative elements within the national curriculum. Also, we can engage men as stakeholders and decision makers, but, through targeted interventions, not, through random or isolated, approaches. We have to really target, the work, considering that they can have, a contribution to gender equality. We must engage men in distributing power and resources for women and girls, and also for other marginalized men and other masculinities that are marginalized. We have the opportunity to work, to continue working in terms of, all the evidence. The images is an example of that. How a survey or multi-country survey can contribute to inform all the policy making. The gender mainstreaming policies in key sectors like education, health, social protection, social inclusion. We have the example of Guatemala that we didn't have enough space for really introducing the work with men and boys. And we have a couple of examples from regions. As you know, the ICA region has just shared how, mainly in Europe and Central Asia, there are policies and laws promoting men care and shared responsibilities for men. In East and Southern Africa, for instance, Sonke, who is part of this conversation today, has worked mapping out the national policies, how the national policies are really addressing the health needs for men and boys. And also, was taken by the SADC community. In LAC, for instance, Brazil has this, very well documented experience working with men in health policies. In Costa Rica, they are promoting, a network of male public servants for gender equality in terms of supporting systems that are responsive, gender responsive. In Guatemala, there is an introduction of CSE through entertainment education in national curriculum and through educational materials going directly to young men. And also in LAC, there is an international colloquium that is convening public universities to join this conversation and promote research that can inform policies. And across regions, we can see that there is the images surveys. And another example that that Leila already mentioned is, this report from UNFPA measuring the SDG target 5.6 that is really reflecting how, there is a huge gap in terms of women's decision making related to, sexual and reproductive health and rights. So it's crucial. The main takeaway from me would be that we need a more systematic work at the policy level to change formal norms that can complement the work on social norms change, how we can look at budgeting, changing discriminatory laws, how we can promote multi-sectoral efforts through the key sectors, and looking at also men as key stakeholders in policy making towards gender equality. Over to you. I'm looking forward to having, a joint conversation later.
Thank you so much, Jose Roberto, for highlighting the role of formal laws, policies, and system when working in gender transformative programming, which is so important to combine with also the grassroots level work. I also see in the chat that there have been some conversations about cross-border dimensions of social norms change. I haven't seen any comments on or questions for Jose Roberto at the moment, but if you have any, please feel free to use the chat and we'll raise them during the session. Thank you very much, Jose Roberto, and let's move on in the program. And now we get to the section where we're going to hear from partners and collaborators in the field, representing both civil society organizations and governments. And first out is Mera Mera. She's an executive director for Partners in Law and Development in India. And she'll speak about her work as a feminist lawyer, in particular as regards to ending child marriage. So Madi, the floor is yours.
Thank you, thank you. It's Madhu, actually.
My apologies, Madhu.
I'm very happy to be here. Thank you for having me. And I think I'll bring my work, share my work, but it touches mostly upon policy issues and engaging with policy and the law, but also speaks to issues of evidence and norm change. Coming from India, it is a very relevant conversation to have because India does have at least the largest numbers of underage marriage just because of the sheer population size. Before I begin to talk about sort of the data, what the data says, that despite this large population of what you say, child marriage, girls and child marriage, what are the new trends that we are seeing? Let me just introduce that Partners for Law and Development, my organization, We're a legal resource group. We work on issues of gender and sexuality and the law, and increasingly in the last few years have been concerned with adolescents as a population group and the impact of laws on this population group. Naturally, because a lot of the laws in relation to adolescents touch upon both age of consent and child marriage, we've looked at both the laws, and I'll discuss it. But to first set the context of early and child marriage in India, that despite the large numbers, what we have seen steadily based on the national data is that the numbers of girls marrying under 18 has gradually declined till in 2015, 2016, the national data indicated that 27% of the girls had married before the age of 18, also indicated that the median age of marriage was increasing gradually to 19 years. That doesn't mean that, that isn't reason for much optimism, because still in terms of absolute numbers, this is a fairly large population. Interestingly, if we go beyond looking at prevalence, what we see in the national data is that it's not a case where the girls are dropping out of school to marry, but actually it is a case of the girls are dropping out of school for two key reasons. One being the poor quality of education, at least in resource-poor contexts, where the girls and their families do not see education as being transformatory, as increasing expanding life chances. And second biggest cause for dropout is unpaid housework, which girls have to bear in resource-poor contexts. So I think when we're thinking about norm change and other implications, this data should be of a lot of significance in informing our strategies. The other issues that we see is that as far as the employment goes, the participation of women in the workforce has been dropping very steeply, and it's almost on par with sub-Saharan Africa, so it's really low. And which means that marriage for women is a source of not just social status, but also of economic survival. So we have a situation where marriage is a compulsory institution for women, not just because of social norms. And what we find is that the other indicators show that early marriage is happening in resource-poor contexts where insecurity is high. Marriage is also equally a compulsory institution for middle class and other sort of and girls in general. It's just that in the context of middle classes, a higher education is a criteria for marriage. So, in a sense, marriage is compulsory across the board, whether you're highly educated or you sort of have not completed secondary school. I think this kind of framework or this context setting is important to understand the law. And I come here to the law as what the law is currently and what the proposals on the table are for it to change and to sort of, in order to tackle child marriage much more robustly and stringently. As of now, India has a law on child marriage which sets the minimum age of marriage for girls at 18 and for boys at 21. It treats, it allows for preventing child marriage and prosecuting child marriage if it is occurring. But once such a marriage has occurred, it's considered valid. And the girl and the boy, if they are minor, they have the right to repudiate the marriage or to have it declared void or annulled, which is very different from divorce. So in that sense, they have the right to opt out of marriage. And this law as it stands is scarcely used by girls to opt out of marriage, although there are some instances of boys using the law to opt out of marriage. But the government has proposed or put on the table the plan to increase the minimum age of marriage of girls to 21 years to bring it on par with boys. And it's considered that if the ages were uniform, it would benefit girls. There's a widespread support for this. It seems almost as if it's a good, strong move, which would bring about change. And the second proposal on the table is to treat all underage marriages as void, as having no legal standing at all, without exception. So while these proposals, it might be counterintuitive for me to say that that Partners for Law and Development and organizations working with young people, women's rights organizations, health organizations across the board in India have come together to oppose both these positions or both these moves, as they're going to be extremely detrimental and harmful to young people who are the beneficiaries. And let me explain why. Part of our research that we've undertaken, both as PLD and research and findings of our allies, cross-sectoral allies, show that a large number of underage marriages are that of elopements, girls marrying of their own choice, running away from home. And running away from home becomes imperative in a context where marriage outside of the community is frowned upon. So in an endogamous system where you need to marry within the community, interfaith marriages and intercaste marriages can often attract honor crimes and violence from parents, punishment, and so on. There is also what we see when we look at one of our studies, which we are going to be sharing in the chat box. When we look at how law is used, we find that the law is overwhelmingly used by parents of girls to prosecute the boys they have married of their own choice. So the law, which was designed to protect young girls, is actually empowered parents and become a tool of retaliation against girls' agency, girls' choice, and has become a substitute for what might have been honor crimes. What we find is the age of consent in 2012 was increased in India from 16 years to 18 years, bringing it on par with the age of marriage, which means that the husbands in self-arranged marriages face prosecution for aggravated rape and for child sexual abuse, which carries very high sentences. So clearly, boys and men are part of the whole concern when we're talking about early child marriage, at least in the Indian context or in any context where either sex outside marriage is criminalized or adolescent sex is criminalized, as in the case of India. We see that girls then do not opt for abortion, safe abortion, or safe sexual and reproductive health services because they fear being reported to the police and being prosecuted. As a result, girls are often forced to carry children to full term or face risks that come with unsafe sex. And there is a stigma against comprehensive sexuality education. It's not been adopted by all states. So there is, again, a gap in that, a very serious gap in that regard. So what we see is actually we're confronting a very complex scenario, which basically signals to us that focusing purely on delaying marriage or on age of marriage is not enhancing girls' agencies or girls' rights. And so an age-centric approach to addressing girls' empowerment is not going to really be transformatory. Certainly not if we have an age of consent which is as high as 18 years, which is the same as age of adulthood. Or if we have laws which are so punitive, and if we see it in this in this context, increasing the age of marriage of girls to 21 years means that they are disabled legally from making personal decisions until the age of 21, until early adulthood. That their parents are empowered to prosecute girls and the choices they make right up till the age of 21. So far, they're doing it till the age of 18. And remember, even if elopements is not a dominant trend, it is the most prosecuted. So it's not forced marriages that are going to court or seeking redress. It is really self-arranged marriages. The other thing that comes with it, which affects boys and young men, is that when all these prosecutions, especially in the case of elopements, are accompanied by prosecutions of child sexual abuse, which is aggravated in nature. So that comes with a minimum sentence of 20 years. And that's a concern that should, be shared even across, different contexts, that we certainly don't wish to penalize in this draconian manner in order to simply delay marriages. The prospect of the very real prospect of treating underage marriages as void, as 2 states in India has done, and in fact even in Delhi we are anticipating certain shifts in that regard, is that we've seen, at least in the state of Karnataka, where we conducted a study and that was supported by UNFPA, we saw that although underage marriages have been denied legal recognition, under COVID, there was a spike in underage marriages, that they all went underground, that it was very difficult to trace these girls. So we are going to have the problem. It's only that the problem becomes less visible. We can't support the girls who need the support of the state as well as civil society organizations. So the findings for us in the course of our work has been really to shift towards resource investments in creating opportunities for girls, in strengthening the agency of girls, in investing in quality education. And I think this can be summed up very aptly in a study done by a coalition in India called the Young Voices Coalition, which documented aspirations of girls under COVID conditions, 2,500 girls. And what the girls are repeatedly saying is they want the freedom of mobility, they want the freedom to do what they want to, they want the freedom to make friends and not be stopped, they want understanding from adults around them. So they're not asking for stringent laws, they're asking for a safe environment, they're asking for an enabling environment and for quality support services. So I think given this experience in India, the 3 issues that I would place before this meeting is really, what do we mean by social norms, when really the social norm at the heart for us in India is compulsory nature of marriage, not early marriage. Whether it is qualified girls, educated professional girls, they all need to be married to acquire the relevant social status. Where does agency go if we focus too much on delaying marriage and on stringent punitive interventions, legal interventions to delay marriage? What happens to agency? And the right of the young girl to be heard, the right of the young girl to have a say whether she wants to remain in the marriage or she wants to exit her marriage. So should that be her decision, or should the state be the patriarch making the decision for her? And lastly, I think for us, the dilemma is about what we call harmful cultural practices. There are competing harmful cultural practices at play here. Early marriage is one of them, honor crimes is the other. Similarly, there is the issue of polygamy or bigamy, because if marriages are declared void without exception, it really is a license for the husband to have no legal obligations towards his underage wife and to marry another time without any sort of legal liability. So it's when we're in terms of cultural practices, there's a whole they all seem to be enmeshed with each other, and for us we can't talk about one without talking about the other, and they are competing in nature. So I think those are the dilemmas which I place before the House, and look forward to more discussions. Our resources are being shared in the chat box by my colleagues. Thank you.
Thank you, Madhu, for sharing these important and very relevant reflections and your experience from India. And I can see, as you mentioned as well in the chat box, there are a number of links to your work and to your reference. So I encourage all the participants to refer to those. And please come also with comments or reflections on the points raised by Madhu in the chat box. Thank you very much. And with that, in the interest of time, because I don't see any direct comments or questions in relation to Madhu's intervention at this point in the chat box. So in the interest of time, I suggest we move on to our next speaker, which is Naila Verdiyeva. She's the head of demographic development sector in the Ministry of Labor and Social Protection of Population in Azerbaijan. And Naila is engaged in the implementation of the gender-biased sex selection program with UNFPA. And we very much look forward to hear the experiences and the lessons learned from Azerbaijan. And Naila, I understand you will be sharing the slides from your side. So please go ahead, the floor is yours.
First of all, I would like to take this opportunity to thank you for the organization of this event, interesting presentations and valuable thoughts that our presenters express. It is my great actually pleasure to join such an event and honor to represent Azerbaijan. In this event and share experience on addressing GBSS in our country. So let's start. I will try to do my best to follow the exact 10-minute time limit. Can you please press to next slide, please? It is quite well known, but still, GBSS is one of the most fundamental forms of gender discrimination, led to distorted sex ratios at birth, and the socio-economic imbalance led to drop of the fertility and the demand for fewer children. Pregnancy termination is a common method to avoid unwanted female births. And next one, please. Let's have a look at international statistics. This is UN World Population Prospects, published in 2019 for the period 2015-2020. There is a top 5 countries with the highest SRB all over the world. You see Azerbaijan ranks 2nd after China. But let's have a look at on national statistics and more recent. Please, next slide. And according to official national statistics, you can see from here that in the beginning of 2020, the SRB was 114. Next, please. how it could be characterized, this trend of SRB in Azerbaijan. Until the early 90s, SRB was mostly within the biological norm. It was just a little high. It was 107. Next one, please. Then SRB in Azerbaijan started to rise and remains consistently high. Next one. The root causes and consequences are almost similar to all countries suffering from this phenomena. Next, please. Coming to the root causes, we can say that the some preference and undervaluing of a girl child, it is one of the main root causes. Patriarchal value systems and stereotypes, gender inequalities comes in place. Fertility decline. It means that families that intend to have a limited number of children are more inclined to sex selection to assure that they have at least one son. Next, please. And emergency of new technologies, interruption of a pregnancy based on knowledge of a fetus's sex. Next one, please. We've just mentioned that TFR decline. It is one of the root causes, and here I'm trying to demonstrate, to illustrate the trend of total fertility rate in Azerbaijan, and you see here that from the early 1960s, the TFR started to decline. And in general, this trend reflects the transformation of reproductive behavior in the society. And we can say that it symbolizes the beginning of the next stage of demographic development, or to be more precise, the demographic transition. And I would say that the decline in fertility is largely due to transition from a model of large families to a family with fewer children. Next one, please. And it's quite interesting to see, this is a live birth, girls and boys. And it's quite interesting that since the early 90s, against the decline of the TFR and live births as well. Next, please. We can see SRB increase. And from the early 90s until 2003, it is more than obvious that it started to rise, despite the decline in live births. And it was mentioned, according to last data from 2009, the sex ratio at birth in Azerbaijan in 114. Next one, please. And this is a statistics from, this is an official statistics from 2013. Sex ratio at birth by birth order. You see that in 2013, next one, please. The total sex ratio at birth was 116, but by birth order, it was 108 for the first one. For the second child, it was 112, 151 for the third, and for 4+, it is 166. And it clearly demonstrates all trends that we, all patterns that we previously mentioned. I would just say that actually this data suggests that the practice of selective abortions in country is quite widespread. Additionally, I would say that the data, we analyzed it, and it can, I would definitely say that with increasing of a mother's age and the birth order, the sex ratio at birth increases as well. Next one, please. This is the statistics from DHS. Conducted in Azerbaijan in 2011, and here you can see that the similar trends was in 2011. Next one, please. We know that consequences of such trends are quite dramatic. This comes to gender inequality, gender-based violence, early marriages, increased level of criminalism, human trafficking. Next one, please. So what we do, the constitution of the Republic of Azerbaijan, this is the main law of the country, states that men and women have equal rights and freedoms. The labor code, the law on employment, and many other national legislative acts ensure equal rights and opportunities to employees regardless of gender in employment and working conditions. It is also noted that necessary measures should be taken to prevent discrimination based on gender and sexual harassment. Next one, please. The major law that focuses on preventing gender-based discrimination and its negative consequences. It is a law on guarantees of gender equality. The changes to the family code, necessary changes to family code was recently done on equalization of the minimum marriage age for men and women. And now it is established 18 for both. The law on prevention of domestic violence establishes and regulates measures aimed at prevention of violence, as well as elimination of reasons for domestic violence. Next one, please. Actually, it is quite hard, but necessary to look soberly at reality, because only by recognizing and accepting probably we can find proper responses and elaborate working mechanisms. So among main challenges, we can name discrepancy between legislative acts and their realization, patriarchal stereotypes in the society, limited number of the CSOs working solely on the issues of gender-based discrimination. Education on sexual and reproductive health and rights is not included in the curricula and or in elective module. We still do have limited data evidence for addressing the phenomenon. I would also name as a challenge the insufficient monitoring on abortions in general and in particular based on sex selection criteria. Next one, please. In response to these challenges, Azerbaijan, with support of UNFPA, conducted several comprehensive researches, including 2 qualitative researches, population and situation analysis, and the set of projections based on different scenarios of SRB. Such efforts aim to build an evidence base for informed policy and decision making in the country. Next one, please. Government and UNFPA's efforts have also focused on working through advocacy by targeting special groups such as health personnel, religious groups, the media, young women, students. We had special projects on men and youth engagement, faith-based groups and local community leaders, celebrity endorsements. Still much remains to be done, but I will share several achievements that we gained. Next one, please. So understanding all challenges and negative consequences of the GBSS and in recognition of a need for cohesive policies in this field, government of Azerbaijan with support of UNFPA developed the National Action Plan on the prevention of and response to GBSS. Among other achievements, we can name increased capacities and improved partnerships between and among all stakeholders involved, government agencies, civil society, academia, international organizations, to maintain and build on the achievements beyond the project's lifetime. I would say that among all international organizations, probably the key partner is UNFPA in our country in addressing such issues. Promoting the gender transformative approaches in the communities lead to additional and behavioral changes. Next one, please. And what are further steps? So the further steps is implementation of the National Action Plan, expanding the existing knowledge base, systematic observation and analysis of the skewed sex ratio at birth, monitoring system for tracking change and the impact of interventions, through BCC communications, challenge the traditional stereotypes and social cultural norms and practices that govern some preference, advocate for the review of the educational curricula, including teaching resources, materials aimed to eliminate gender-based discrimination and stereotypes that reinforce the formulation of gender roles in the country. And I would definitely say that still much remains to be done. It is difficult at first, but over time, we hope that a strong will and determination in continuing the way with help of our partners at local and international levels will lead us to the significant progress on addressing GBSS in Azerbaijan. And I would like to end my presentation. Actually, Martin already ended it. But I just wanted just to stop on the last one, on the last slide, please. Yes, please. I wanted to end my presentation with a quote from a poem by the prominent Azerbaijan poet, Hussein Javid. The more empowered the women, the better the world we live in. After this, I have nothing actually more to add. Just thank you for your attention.
Thank you very much, Naila, and apologies for ending your presentation a bit too early. And I'd just like to take this opportunity as well to congratulate you on all the achievements and all the good work you've done so far. And please feel free to share links to any resources that you have developed in the chat, so that also other participants who may be interested can access those resources and learn from what you've been doing in Azerbaijan. But thank you very much for that very clear presentation. I don't see any specific questions or comments for you, Naila, in the chat at this stage, but please feel free to share that in the chat as we move on, and we'll address it in the final Q&A session. Thank you very much, Naila, once again, and we move on in the program. And our next speaker is Mpiva Mangwiro. She's a regional campaigns and advocacy specialist at Sonke Gender Justice based in South Africa. And she'll be talking about changing social norms to end harmful practices.
Thank you. And good afternoon and good morning to everyone. I hope you can hear me. Sorry, can you hear me?
Yes, we can, Mpiva, and your slides are being displayed. So please go ahead.
Okay, thank you. I just wanted to confirm that. Okay, so I'm going to talk to the issue of engaging men and boys to change social norms for ending harmful practices with a specific focus on FGM. So thank you. You can move on to the next slide, please. So briefly to say that I'm from Sonke Gender Justice, which is part of Men Engage Global, and we are also a part of Men Engage Africa, where we are the secretariat, and I will not take too much time in terms of who Men Engage Africa is, but to say that it consists of organizations that are working across 22 African countries, and we work in partnership with civil society organizations, public organizations, and decision makers on progressive and proactive engagement of men and boys in areas of health, gender-based violence, HIV and AIDS, SRHR, parenting, and human rights. So our work is collaborative. We work collaboratively, and this involves, for example, a regional campaign that we have to advocate for an end to FGM. Next slide. Thank you. So as is already common information, FGM exposes women and girls to serious health risks. And while various reasons are given for the practice of FGM, these are associated with ensuring that the girl child conforms to key social norms such as sexual restraint, such as femininity, respectability, acceptability, and maturity. So it's mostly embedded in social norms that seek to portray a girl child and to restrain a girl child to conduct themselves in a certain way. And it is also considered a rite of passage to marriage. So because of all the harmful effects and the harmful impact of FGM, as Men Engage Africa, we developed a regional campaign which seeks to engage men and boys to advocate for an end to FGM. And through this campaign, we've been able to engage men in their diversity in the different countries. So far, within the Men Engage Alliance, we have 11 countries where FGM is practiced. And we've been able to, international level, as well as at a regional level, we've been able to work to engage men in their diversity so that they can advocate for an end to FGM. And what has been our experience on the ground? What we've realized is that over the years, our experience have shown that there's now more receptiveness by men to address the challenge, to address and challenge social norms that perpetuate the practice of FGM once they understand the health risks and the threat it presents to women and girls' rights. So we've realized that information sharing is very important for men and boys to understand the effects, the negative effects that FGM has on women and girls. And also because one of the reasons that it is done is also done for the benefit of men, that women are then able to be pure and to be able to restrain from any sexual activity until they get married and they are presented pure to their husbands and all. But once men understand the risks that come with that, you find that they are willing to come on board and also advocate for an end. And one of the lessons that we've also learned is that when we are talking about the issue of addressing and challenging social norms, this is an issue that has to happen at different levels, like has been earlier on alluded to, different levels of the socio-ecological model. You find that there is the level where you need to engage at a community level. You need to ensure that it transcends to the interpersonal level. Is also the need, you engage and ensure that there is that engagement at an interpersonal level, there's that engagement at a community level, but also there's the engagement that needs to happen when it happens at a policy level, because you find that there is need for these initiatives to complement each other. What we've learned is policies alone not adequate to translate to social norms change, because this is a process. This is something that takes a long period of time. So you find that there's also need for other initiatives that have to be implemented at community level, at ground level, while there's also need for other initiatives to happen at other different tiers. And what we've also realized is that women's rights organizations are also becoming more open to this work. In the past, or when the work around engaging men and boys was initially starting, used to be some challenges and some friction, but over the years there's been an appreciation of the value that work engaging men and boys to challenge and transform social norms bring to the issue of addressing harmful practices, and also to the issue of promoting women and girls' rights. However, there is still that room that sometimes such work can be misinterpreted as attempting to reinstate men into their so-called legitimate place. So there's always a need that when framing this work, it comes out clearly that the work is there so as to augment the work that is already happening, that other organizations, women's rights groups have already been doing in terms of challenging harmful norms, in terms of promoting women and girls' rights. So there's need to always center that and ensure that it's framed in such a way that it is augmenting, it is working with, and also it's important to always work in consultation with women's rights organizations and not to seem to be assuming agency over work that they've done over the years. And also sometimes you find that men can reject this work because of perceptions that their rights are being taken away. But as we have said, that once sufficient information is availed, insufficient understanding is obtained in terms of the harm that not only happens to women and girls, but if the cost is also shown to be a societal cost, is also shown to be a cost that also affects men themselves and boys, then there is that willingness to come together and work on challenging some of these harmful norms. Next slide, thank you. So the next question has been, well, how do we do this? How do we do this work as Sonke and the Men Engage Alliance? And one of the ways that we do this work, one of the ways that we've implemented our FGM campaign is to address violence and harmful practices such as FGM through social and gender norms transformation and encouraging positive masculinities. So one of the things that we've learned in this work is that when you challenge harmful masculinities, and when you seek to promote gender norms change and transformation, there should also be a promotion of something positive. There should be a promotion of alternative rites of passage. There should be a promotion of positive masculinities, so that when we are challenging the toxic masculinities, some of which further the harmful norms and the harmful practices that are the drivers of such practices as FGM, when we challenge those toxic masculinities, there's a need to then promote positive masculinities that can be able to help advance and sustain this work. And gender transformative programs involving men and boys are often designed to enable them to explore rigid societal norms about manhood, about boyhood, and examine the costs and consequences of these norms for men, for women, for children and their communities, and explore positive alternatives. I think that's already alluding to what I said earlier, to say there has to be shown that the cost is impacting on everyone. So when we then explore some of these rigid norms on manhood, on boyhood, they also show some of the limitations and the challenges that they are placing on men. They expose the limitations, the challenges that they're exposing on women, and when that cost is understood from that perspective, then there's room to explore some of the positive work. And I just then pulled out some of the examples in terms of how we do our work. That is an image of one of our partner organizations when they were having their gender norms transformation session in DRC with men, where they will be trying to then help men to challenge some of these rigid, some of these toxic masculinities, and in exchange begin to promote positive masculinities, begin to promote positive gender norms that also include men carrying responsibilities, taking care of their family members, taking care of responsibilities that are often perceived as duties of women and girls. And we do this work also through capacity building with partners and communities on gender norms and approaches. I've spoken to that. Our partners in Tanzania have engaged with young girls and boys on gender norms, on harmful practices, its health implications, while our partners in Uganda also encourage men and boys to rethink their use of power and focus on the collective community-wide responsibility and to uphold and respect women's rights and dignity, because also at the core of this issue about social norms is the issue of power. And once there is a need to also explore the power dynamics and to rethink how the power that men traditionally hold can be transformed into a way that is progressive, into a way that can also promote women's rights, women's dignity, and be beneficial to women's health and men's health as well. And also we do community awareness raising and mobilization, which includes discussions, which includes dialogues. For instance, our partners in Sierra Leone ran a project called My Body, My Rights, which was also supported by the Big Lottery Fund in UK, and managed to raise awareness in 33 communities around the issue of social norms change, and some of the conversations and some of the issues. For instance, even the issue of FGM is an issue that was generally an issue that one is not supposed to easily talk about or openly talk about in Sierra Leone, but through these processes, you find that men are also now able to openly engage and talk about these issues and challenge some of the norms that are driving these issues. And one of the other ways that we work is we engage with religious and traditional leaders, address religious or cultural social norms that support continued practice of FGM. With the support of UNFPA, we have been able to hold a consultative meeting with at a regional level. We were able to hold a consultative meeting with regional and traditional leaders, where we began to explore and engage and address some of these religious and social norms that perpetuate the practice of FGM, and also engaged in some of how the mechanisms and how religious and traditional leaders can also support initiatives for calling for an end to the practice of FGM. And also at a national level, you find that, for instance, our partners in Sierra Leone managed to engage with imams, with pastors, with chiefs, with women leaders, and they've since often agreed and signed a voluntary agreement and a vow at a community level gathering with a promise never again to practice, support, encourage, or give their girl children to underage marriage and FGM practice. And also at a regional level, we've also engaged in various advocacy initiatives, also calling for the engaging of men and boys, for the engagement of men and boys to challenge harmful practices and harmful norms. For instance, at a high-level ministerial meeting held in Ghana to launch the African Union Commission evaluation report. After 9 years of implementation of the campaign on an accelerated reduction of maternal, newborn, and child mortality in Africa, we were able to host an event there where we made presentations on why engaging men and boys in FGM prevention is important. We also had panel discussions on engaging men and boys around social harmful gender norms, and this resulted in an outcome statement with the ministers and stakeholders present at that meeting, calling for an African Union heads of state and government resolution and continental campaign on the elimination of FGM to facilitate coordinated voices, efforts, resources, and reporting, and resulting in the new AU Salema campaign to eliminate FGM. And we're also in the picture that I have shared, which shows part of the team from Sonke and also from Men Engage Africa, where together with UNFPA, we were also able to organize the 10th Pan-African Parliament Annual Women's Conference, which was under the theme, the role of parliamentarians in promoting international and regional human rights instruments, especially relating to women, youth, peace and security, and FGM in order to achieve the demographic dividend. And so we had many engaged partners and members from countries like Kenya, Cameroon, Mali, Tanzania, who were also able in those spaces to share experiences on how they are ensuring that men and boys are part of the solution in ending harmful practices, in changing gender norms and fostering gender equality. And this was a platform that was also used to call on additional support from policymakers on engaging men in the campaign to end FGM. And from that, there was also an outcome document in which Pan-African parliamentarians also committed, who were legislators in their respective countries, they committed to advance the discourse on legislative measures and budgetary allocations to address harmful practices in their countries and to push for provision of healthcare services for women and girls who had been impacted by FGM. So that shows that our work has been, we complement what is happening at national level. We then complement it by also getting it and implementing regional level efforts and mechanisms to ensure that that engagement at different tiers continues to happen and sustain the work. And some of the lessons that we have learned really are that men and boys should be engaged as part of the solution and not simply the problem. While we know that most violations around gender-based violence and so forth are perpetuated by men, when it comes to the issue of addressing these issues, there is need to also recognize them as part of the solution and not just as simply the problem. And also to recognize that men have a stake in changing gender inequality and can take action to support that change. And there's also need for inclusivity of and responsive to the diversity among men, including social and sexual diversity. So there's need to recognize the diversity that men have and engage them in taking cognizance of that diversity. And also, as I said, ultimately accountability also women's rights organizations is critical so that we can be able to continue to work in partnership. Thank you.
Thank you so much, Mapiva, for that very useful presentations. I noted that you highlighted many of the issues that are so key to working with men and boys, such as working together with the women's movements, religious traditional leaders, and recognize the diversity among men, and see men and boys as part of the solution, as not as a problem. That's really important. And you mentioned many other things that are also very relevant for social norms change. And it's very nice to see the very good work that Sonke Gender Justice are doing across Africa. So thank you very much. And we are quickly running out of time, so I'd like to move on in the program. And this is our last speaker. And this is Angel Del Val. He's a country representative of the Population Council in Guatemala. And he'll speak to transforming power dynamics in the work with indigenous communities and adolescents, and when they use, for example, comprehensive sexuality education. So Angel,
thank you.
Please go ahead. I'll share your slides from this side.
I'd like to start by thanking you all for inviting me to share with you our experience working in Guatemala. So we can go to the next slide. Thank you. So Guatemala, it's a country of 17 million people. It's diverse in the sense that we have at least 23 different linguistic communities, which is equivalent to saying that we have different ethnic groups, and half of the population is indigenous, and yet much of the bad outcomes that we observe among children and adolescents are concentrated in the indigenous territories. So as you can see in the two maps on the screen, on your left, you can see that indigenous people, by the different languages that are spoken, linguistic communities, are concentrated in the highlands, in the northern part of the country. So that's where traditionally they've been. And as you can see on your right, unfortunately, these indigenous territories are also hotspots of child marriage, school dropout, and harmful practices that have different shapes and sizes. So in particular, one of the negative life events that we observe consistently through time is that of adolescent pregnancies that are an expression and a result of sexual violence that mainly affect girls that live in remote communities far from services that happen to be mostly indigenous girls. So we started to study this situation back in 2004. And since just out of studying the DHS and national surveys, we were able to identify that there are gaps in school enrollment where indigenous girls, in particular, indigenous girls living in rural communities, lag behind the rest of their peers. That is, boys, indigenous boys, and non-indigenous boys and girls. Next slide, please. So as a response, we developed a community-based approach that is culturally appropriate to the indigenous context. So these are safe spaces where girls meet regularly. And there, what you can see in the photo on the green blouse, that's the mentor. And the mentor is also an indigenous female young woman from the community. And with UNFPA back in 2013, we had the opportunity to implement the program at scale. When so we identified one of the hotspots in Guate where we had concentrations of bad problems. So there was an overlap between an important proportion of indigenous people, poverty index, severe poverty, extreme poverty, malnutrition, and on top of things, girls were dropping out of school at an early age. So in this context, we were able to set these safe spaces in 50 communities in a single district. And that raised a lot of visibility in terms of what we were doing for the local decision makers. And so these mentors have the basic task of getting trained to deliver comprehensive sexuality education content to the girls that they work with on a weekly basis. So as we started to implement these safe spaces programs, our focus was specifically on girls because of the restrictions that they have at the community level. So these restrictions are driven mostly by social norms, gender norms, that say that girls need to be doing the domestic work that it's no worth investing in their education as opposed to what a male can achieve in life. And so these mentors, what we have observed is that when you have a group of at least 20 mentors working in a single district, they are able to raise the visibility on the cause, not only of girls, but also boys. And so if we go to the next slide, what we learned is that out of working with girls, that mentors had a lot of information. So they were key to adapt the materials and to contextualize the work. And so mentors quickly started saying, well, you know, we work with girls, we deliver information, and we observe that there are positive changes in their aspirations. But we think that boys should be engaged in some capacity. And so with UNFPA, we started to explore what was being done in the region. And so the White Ribbon Campaign is something that in Latin America has been an important effort to mobilize boys and men in different settings. So not only from civil society, but also in schools. And so when working with adolescent girls, indigenous adolescent girls, we have found consistently that there's very scarce, the knowledge of sexual and reproductive health and rights is very scarce, meaning that only 3 in 10 girls can properly identify what are the rights that they are entitled to, what are the services that they are entitled to, and how they can access them. And so when mentors started to interact with boys, we needed to look for a platform or our approach. So we had the foundation of these girl-centered safe spaces, but we realized that we could do simultaneous work to engage boys with one mission, with one platform, or with one goal. And that one goal was the White Ribbon Campaign. And so we started working in schools. Mentors themselves, these female mentors, led the initiative, and they recruited and trained these young leaders in the school setting that already had the drive to teach others about sexuality, to try to teach others about prevention of violence. And we also found that they had the same challenges that girls in terms of the lack of access to SRH knowledge on sexual and reproductive health. It was very scarce. And so there was an effective entry point to talk about the prevention of gender-based violence out of starting to discussing power, gender, sexuality. And so that led to the comprehensive sexuality approach that we were using with girls too. And the effective entry point was to ask them to be part of the prevention efforts and supporting girls by mobilizing through the White Ribbon Campaign. So the White Ribbon Campaign is an effort where these young boys, adolescent boys, usually 15 to 18, who are still enrolled in school, who are very active, get trained, produce some materials, and work with their peers, in the school setting, to implement a week of activities. So in this week of activities, prior to that, there's mentors visiting them, working with them, raising knowledge, and delivering some of the content that Promundo has developed, and the materials from the White Ribbon Campaign that are widely available in Spanish in the region. So given that mentors have the skills to contextualize and adapt program materials, it was easy for them to lead this group of boys into developing materials and replicating that in the school setting. Surprisingly enough, teachers had a very good reception to our efforts. And as they said, teachers, and it's something that you hear frequently, that they don't have the skills, the training, or the resources to deliver this kind of content in the school setting or in the community setting. So what's surprising in the, or maybe not surprising, but what is a lesson learned and something that we should take from the work with indigenous communities is that indigenous leaders and community leaders and teachers have a genuine intention to interact with adolescent boys and girls, but lack the tools, lack the training, and lack the resources to do so. So these platforms of mentors and these networks, when we implement them with the intention to get to a place where we know there's going to be a concentration of bad problems, and when we have the opportunity to raise the visibility of the need to engage girls in safe spaces to improve not only enrollment in school, but also their mobility, their visibility at the community level, then these mentors that lead girls into the safe spaces meeting have also the potential to be trendsetters, right? And engage boys in raising awareness, in talking about power, in discussing gender and sexuality. And that is the starting point to start talking about services and to start training them into wider advocacy efforts. So as we were discussing with with Jose Roberto about what to share from our experience here in Guate, I think the key message is that girl-centered programming largely benefits from also engaging boys. We initially thought that it was going to be a complicated process because we had to start training and recruiting these male mentors. But it happens that these female mentors that are local, that know how to adapt program tools, are also able to engage boys in a more effective way than any other person could. So at the moment, we have this positive interaction between girls, female mentors, and the White Ribbon campaign being implemented at the school level. It's not as expensive to implement as you would think, as most of the materials are developed. So I think it's step one for every person that's planning to implement programs at the community or school level is to have this mindset where your program components and your efforts to design a program can be sequential to reach girls, but then also include boys in a simultaneous way through these kind of initiatives that are short to implement, easy to implement, and that mobilize adolescent boys effectively around one cause, and that is the prevention of gender-based violence. That eventually leads to also discussing harmful practices. So I'd leave it at that because of time.
Thank you so much, Angel. Very interesting to hear the experience and the lessons learned from Guatemala. Very relevant for the topic, and thank you so much. So in the interest of time, I think we will have to conclude the session here. I'd just like to take this opportunity to thank all the speakers. We've listened to speakers from different regions, from different organizations, talk about a number of different conceptual and practical issues that are so relevant for ending harmful practices and advance gender justice as a whole. And I'd particularly like to thank the speakers from the field for sharing their reflections on what's happening at the grassroots level, because when it boils down to things, that's where we make the changes in the lives of women and girls, and that's in the end is what we are all working for. And also please have a look in the chat. We have some interesting discussions there about the working with men and boys and women and girls, and about child marriage. So thank you very much, everyone, speakers and participants. And with this, I'd like to hand over to Leila Sharafi to share a few key takeaway messages from the session. Leila, please go ahead.
Hi, thank you so much, Martin. And just to, in brief, I'd like to again thank everyone for their time, for the speakers, for their fantastic interventions, for all of the participants who shared their precious time with us today, and participated in yet another Zoom call, which we know are many these days. But thank you all so much. And also thank you to the contributions in the chat box. I certainly won't attempt to summarize all of the rich reflections that have been shared here, but I think there are a few key principles and takeaways that we can count on having heard today. One is, of course, using an intersectional lens. I think particularly the last presentation really showed us that, when we talk about challenging power and we talk about changing norms, we really have to think about, marginalization, exclusion, oppression, and how power interplays between all of those. I recently heard a presentation where someone said systems of oppression attract one another and they're magnets. And so I think one of the things that we really want to make sure we do is, apply that lens of intersectionality when we're talking about, who has the power and who uses it in ways that we want to address. I also, of course, want to point out that when we talk about engaging men and boys, what we heard clearly is that we have to really start young, and ways to reach boys is always a challenge. But again, through the presentations, we saw creative ways in which we can do that. Of course, comprehensive sexuality education is an absolute winner in terms of reaching boys with messages of respect, equality, justice, fairness. So I think this is something we have to really see as a mechanism for reaching boys, and that early socialization that we know is so critical. In terms of partnerships, this message continues, and specifically, I think, of course, with the feminist movement and organizations that have a feminist objective, and organizations that really are there to be key interlocutors for those who have been most left behind, marginalized, and excluded. I think at the same time, it's been clear that working with government and sort of at the to help us reach that systemic level, which is so critical, is key for reaching scale, but also for addressing those stubborn norms that we talked about at the systems level, because patriarchy really has to be tackled from all angles. And then finally, as my colleague Nurgul said, I really liked how she talked about the gateway. Many of these thematic issues that we're talking about, whether it's harmful practices or issues related to maternal health, we saw that fantastic video at the start of the session on engaging men through the husband school on maternal health. And so a lot of these issues provide us with such a valuable gateway or entry point to engage men and also work with boys to challenge underlying gender inequalities. And so I think for UNFPA, certainly what's been really helpful for us is that working on maternal health, working on family planning, working on CSE have enabled us to access men and boys, to be able to relay and talk about some of those discriminations that women and girls face, and the gender inequality that really affects everyone. So with that, again, I'd like to say thank you so much to all of our speakers and to the participants, and feel free to share this session with those who were not able to join us today. And we really look forward to continuing to be part of the Men Engaged Symposium and seeing all of you soon. Thank you so much. I think Sinead sent me a message here saying, we'll add the recording of the session to the Men Engaged Alliance YouTube channel and the Symposium app in the next few days. And all previous Symposium sessions are now available on these channels if you've missed any of these sessions and would like to watch them now. Great, thank you, Sinead. Thank you again to Men Engaged and to my UNFPA colleagues. And have a wonderful evening, afternoon, and rest of your day. Bye-bye.
Thank you, everyone. Goodbye.